I'm Dr. Mario Morales with the SSM Weight Loss Institute. It amazes me that diseases that were once considered to be incurable can be cured with weight loss. Take, for instance, diabetes. Every week, I have patients who are being cured of this life-threatening condition. For most people who become diabetic, morbid obesity is often the major underlying cause. Obesity is the disease, and diabetes is the symptom of the disease. So just like any other disease, it's almost always better to treat the primary disease rather than just treating the symptom. If you are diabetic and you lose weight by any mechanism, your diabetes will get better because your blood sugar will be under better control. Weight loss surgery will significantly improve your diabetes because you will lose much more weight than you would with any other way. Bariatric surgery patients are also more likely to keep that weight off. In many cases, the extreme long-term weight loss will actually make a patient's diabetes go away for good.
The day that I checked out of the hospital, they took me off of probably 5 out of the 11 or 12 drugs I was taking, including one piece of the insulin. A month or two later, my endocrinologist said, "You're no longer a type 2 diabetic. Your cholesterol is just awesome. It is really awesome. Don't worry about taking insulin anymore."
In addition, there is another internal mechanism that provides blood sugar control after weight loss surgery, which we have seen over and over. While science can't explain how the mechanism works, it improves blood sugar almost immediately after surgery, and it improves it dramatically. Gastric bypass has been clinically proven to be the most effective surgical procedure for helping diabetic patients. With gastric bypass, the chance of you being completely cured of your diabetes is about 80 to 85%. With either the gastric band or the sleeve gastrectomy, you will still improve your diabetes significantly and eventually get off your medications. It just typically takes a longer period of time. Weight loss surgery is proven to be so successful for helping diabetes that the National Institutes of Health has now changed the qualification criteria so that a patient with a body mass index of 30 can qualify for the procedure if he or she also has diabetes. Typically, a patient would have to have a BMI of at least 35. Insurance plans will usually cover weight loss surgery as a treatment for morbid obesity. Each plan has its own set of criteria to meet. In many cases, the surgery is more likely to be covered if the patient has a related condition like diabetes. Our expert staff at the SSM Weight Loss Institute can work with you to help determine what your insurance will cover. You should remember that diabetics always have a higher risk of infection when undergoing any surgical procedure. However, for most patients living with diabetes, weight loss surgery is a very small, short-term risk for a very large and long-term benefit. There is a way to get off your diabetes medications and get back to living a healthy, normal life. At the SSM Weight Loss Institute, we are dedicated to partnering with you to ensure the quality of life you seek and deserve.